Hello, everyone. As people are joining, I just want to take a moment to welcome you all to our pre-application webinar for the Center for Rapid Surveillance of Tobacco to assess changes in use behaviors, product marketing, and the marketplace. My name is Kay Wonke, and I'll be emceeing today's webinar that will share information about the scientific, programmatic, review, and grants management aspects of this new funding opportunity announcement. And during the webinar, we'll be referring to the Center for Rapid Surveillance of Tobacco by its acronym CRST. I'm just going to give us a little bit of time as people are joining before I move on. Next slide, please. Thanks. So the request for applications for CRST is published through a unique interagency partnership between the NIH and the FDA Center for Tobacco Products. We refer to this partnership as the Tobacco Regulatory Science Program, or TRISP for short. TRISP is also the name for the coordination office that sits within the NIH Office of Disease Prevention, which has the oversight responsibility for the program and for the administration of grant activities like publishing requests for applications or hosting grantee meetings. And through this unique partnership, several NIH institutes and centers partner with the FDA CTP to support research informing tobacco regulation. And it's important to note that NIH research supported by FDA funding provides the scientific evidence needed to inform FDA's regulatory mission. And this research is in addition to the tobacco control research that's funded by the NIH institutes and centers. Next slide. And so you can find more information about the Tobacco Regulatory Science Program on our website, which I have a screenshot here. Be sure to use a sidebar on the left of the page to navigate within the TRISP website. My red arrows here are pointing to where you can find more information about TRISP. You can find past and current grants that are funded through the program to learn what has been funded previously, identify potential gaps as you prepare an application. And it's where we will post a frequently asked questions document, as well as a recording of this webinar for future reference. Next slide. Both the FAQ document and the webinar content will be posted probably in about 2 weeks. And I've circled where on the navigation menu you would click to find the CRST webinar page. Note that after the FAQ document is posted, we'll continue to update it with additional questions as we receive them. So you may want to check back regularly to see if there's additional content that might be helpful as you prepare your application. And then also, of course, feel free to continue to send us questions after today's webinar. Next slide. I want to start with some housekeeping information before we begin the webinar. First, if you're interested in seeing the closed captions during the webinar, look for the multimedia viewer that's at the bottom right corner of your Webex window, like we show here. First, find those 3 dots and then enable the multimedia viewer. Okay, next slide. And if you'd like to make the content on your screen appear larger or smaller, use the plus and minus magnifying glasses to zoom in and out. And you'll find those plus and minus symbols in the bar that's on the left-hand side of your window. And if when you mouse over or hover over the left-hand side of the slides here and don't see it, you may need to click on some part of the screen, like in the taskbar, in order to see it. And if you have questions or are experiencing technical difficulties, you can send a message to us in the Webex Chat forum. Be sure to address your message to all panelists, and that way it'll be seen by those of us who are conducting the webinar. Just note that if you send a message to everyone, it will be viewed by all the webinar participants and you will no longer remain anonymous. We're asking that questions about responsiveness or specific research types of questions are not asked during the webinar and are best discussed with the individual program contacts that you'll find in the RFA, and of course for me or for the contacts that are going to be providing the administrative review and grants administration during today's webinar. So keep in mind that this is because the answer to almost all the research questions that you might pose and about responsiveness is it depends. So it can be confusing if we provide sweeping generalizations here. So for this reason, it's important to share your specific aims with us before you submit your application. Okay, next slide. So here's the agenda for our webinar. Kathy Backinger will start us off by sharing information from FDA's Center for Tobacco Products, and then we'll hear from team members who will explain the key application, review, and grants management details of the RFA. So let me turn it over now to Kathy Backinger, who is the Senior Science Advisor in the Office of Science at FDA's Center for Tobacco Products, who will discuss how CRST can inform FDA regulatory actions.
Thank you, Kay. Excuse me. Thank you and welcome everybody. Thanks for joining us today. I'm just going to spend a few minutes about why the FDA Center for Tobacco Products is interested in funding and launching the Center for Rapid Surveillance of Tobacco. Next slide, please. And I know that most of you, if not all of you, had heard some of this before, but obviously it's important just to remind all of us and put into context while we're here. As you know, back in 2009, that seems so long ago now, that CTP or FDA was given authority to regulate tobacco products. And at that time, it was limited to cigarette tobacco, roll your own, and smokeless tobacco. And then in August of 2016, when the FDA, we call the deeming rule, came out, we were given authority to then use our statutory regulatory authority to include all tobacco products. And you see the list here, but you know, obviously ENDS didn't even exist in 2009, at least not in the way that we know them now, but it included within our scope and our authority cigars and pipe tobacco and others, and all future tobacco products. So that gives us complete authority, or mostly complete authority over all tobacco products. Next slide, please. So what are our authorities? And again, I know most people know this, so I'm not going to just go down and read each of the lists, but just to remind us that before a new product can be marketed in the United States, they have to seek and get authorization from FDA to sell and market those products. We also have parts of the Tobacco Control Act that we require post-market surveillance of these newly authorized products. We have the ability to implement and pass product standards in order to reduce harmful and potentially harmful constituents or components of tobacco products. We can also do advertising and promotion restrictions and require health warnings. Next slide, please. Now, I think it's also useful to remind us that we're not like other parts of FDA. We do not assess whether we authorize a product or not based on a standard of safety and efficacy as other centers do within FDA, but we have to consider the population as a whole, and it's explicitly outlined in the Tobacco Control Act as the population health standard. And so we have to understand not just the impact on the user, but also on non-users. We have to assess the health risks of the product. We have to understand and assess the likelihood of existing tobacco users, whether they'll stop using products. And we have to assess the likelihood that non-users will initiate tobacco use or former users will relapse back to tobacco use. So that's particularly why we need to understand what's going on at the population level. Next slide, please. So as you know, there are quite a few large federal surveys and cohort studies. These are just a few, but these are the ones that CTP provides support for, whether partially or wholly. As you know, there's other surveys and studies such as Monitoring the Future and BRFSS. But here's the challenge as it's been for the federal government. It takes time to collect the data, clean the data, analyze the data, and report the data. And it takes longer than we would like. It sometimes takes maybe on a good year, about a year, but it takes us a little bit longer to get those data so we can really see what's going on out in the population. So because of that, FDA is looking for ways to get data more quickly than these traditional methods. Next slide, please. So what is FDA's need for rapid surveillance? I think most of us know a lot of these points, but just to go over some of them, we know the tobacco product landscape has been rapidly evolving. You know, we've got so many different types of tobacco products on the market, including varying characteristics and constituents. We see that there's dual and poly use among youth and adults. And the dual and poly use occurs among all ages. So, and it varies by age, it varies by gender, it varies by race, ethnicity. It varies by the types of tobacco products. I want to say that early on in the PATH study, I think there were something like, I wish I have the number, but at least 120 different combinations of dual and poly use. So those are just some examples of dual and poly use. We've seen a rapid increase in the use of ends by youth and the kinds of ends that youth are using. We've also seen a shift in the age of initiation of smoking from youth and into young adulthood. Now that shift, you know, we used to say that most, you know, we know that most adults that smoke started smoking when they were teens. And we used to say, well, if we got kids out of, you know, by the time they're 18, you know, we kind of have the problem or the challenge resolved. And that's not true. We've seen a shift from mid-teens to later teens and into young adulthood. So now it's not only youth who are initiating smoking. We have persistent tobacco-related health disparities. We have a variability in policy context, both at the state and the community level, different policies being passed and implemented and trying to understand the impact of those policies, both intended and unintended consequences. Different changes in tobacco industry marketing with the increase in social media and social media influencers and some ability to advertise on TV. And then, as I mentioned, when we authorize tobacco products, both for pre-market new tobacco products through the pre-market tobacco application process or modified risk tobacco products, there's post-market surveillance that needs to happen that could inform us. And then interestingly, I just read an article that was in the New York Times yesterday, and it was called "That Cloud of Smoke is Not a Mirage. Cigarettes, once shunned, have made a comeback with a younger crowd who knows better." So this article, if you hadn't read it, talks about how mostly young adults in New York City are posting selfies smoking because, hey, it's kind of cool now. It looks and feels cool, and people are kind of thinking it's a group activity and a celebration. They want to come out of COVID, and this is something they can do. And, you know, like, why not? We like survived COVID. And one quote, there were a couple of quotes. Somebody said, "It feels grunge sophisticated, and it's a joy to be contemporarily atypical." So that's just an example of, you know, is that a blip? Is there going to be an increase in smoking among young adults? And having data more quickly certainly would be helpful. Next slide, please. So how do we use these data? Well, as I've mentioned a little bit, you know, we need to understand the regulated products, but it'll help as we review new products before they can be marketed. It'll provide information on whether we should authorize these products. We can review, it'll help like reviewing claims for modified risk products. We can, again, I mentioned restricting marketing and distribution as one of our other goals is to decrease the harms. So we want to authorize products that pose less risk, and having surveillance out there to give us more data, give us data be certainly useful. It'll help with compliance. I think most of you have seen a lot of our compliance actions going after products that are appealing to youth and doing having enforcement discretion, to pull those off the market, as well as educate the public. Next slide, please. So as mentioned in the funding opportunity announcement, the overall purpose of CRST is to assess changes in use behaviors, product marketing, and the marketplace to better understand the rapidly evolving tobacco landscape in the United States. And we are looking for rapid or sentinel data sources or systems that can provide us timely data on changing tobacco use patterns, information about conventional and new authorized products and factors that contribute to their use, and observing changes in the tobacco marketplace. Next slide. Now, it is outlined in the RFA that CTP will serve as a sentinel site. And so while we have access to quite a few data sources, it's not all the data sources, and certainly even having one data source is not enough, meaning to complement each other. So we do have access to data source, sales data, advertising data. We have access to the poison control data. I think most people know that we have a portal to report adverse events, and we have those data. Also looking at social media, some consumer behaviors and perception, and we also have information from different outlets about what's happening as far as tobacco industry news and regulation tracking. So once the award is made, then we will have, since CTP will be a sentinel site, we'll certainly have a meeting with whoever the awardee is to talk about our data sources and how to coordinate that. Next slide, please. And with that, I will end, and we'll take questions at the end. Thank you.
Great, thank you, Kathy. That was fantastic. And now we're going to be moving on to our next presenter, who is Maria Roditis. She's the scientific and research contact for the RFA. You'll find that in the RFA. And she's a program director in the Tobacco Control Research Branch at NCI. And so she'll be talking to you about the programmatic aspects of the RFA. So thank you, Maria.
Hi, everybody. So I'm happy to talk with you all about this RFA for the Center for the Rapid Surveillance of Tobacco, which we're also referring to as CRST, trying to get that going. I'm going to briefly talk about the different aspects of this RFA and some somewhat unique considerations regarding the RFA. So we can go to slide 2. The main purpose of the center will be to do the following, which Kathy also briefly touched on. We want the center to assess changes in use behaviors, product marketing, and the marketplace to better understand the rapidly evolving tobacco landscape in the U.S. We also want the center to support time-sensitive data acquisition strategies, data harmonization, data synthesis and analysis, and reporting activities on emerging and current tobacco use trends. The center will work collaboratively with NIH and FDA CTP to implement a model that utilizes multiple data sources to identify emerging tobacco use issues and to track tobacco use trends through regular monitoring of key data from sentinel sites. And of course, results from this research are expected to generate findings and data that are directly relevant in informing the FDA's regulation of the manufacture, distribution, and marketing of tobacco products to protect public health, which Kathy also went through as well. So if we go to slide 3, we can dig deeper into the specific topic areas that we expect the CRST to address. And of course, this is all listed in the RFA as well. CRST must address the following. They must address the rapid surveillance of changes in tobacco product use behaviors, which includes changes in tobacco use behaviors among youth, young adults, and other populations with tobacco-related disparities, changes in how these groups access or obtain these products, and also emerging trends in these use behaviors. The center must also address the rapid surveillance of tobacco product marketing, including recent changes in mechanisms or platforms of current tobacco product marketing in traditional and non-traditional channels, and recent changes in industry tobacco product marketing strategies. Lastly, the CRST must also address the rapid surveillance of tobacco product marketplace. So this includes recent changes in the tobacco retail environment and recent changes and/or trends in tobacco product sales. So these are the main topic areas that we expect the CRST to address. And of course, a deeper dive into all that is in the RFA. So if we go to slide 4, we know that along with the topic areas that CRST is responsible for, CRST also has the following responsibilities: to establish and convene meetings of a CRST steering committee, to establish one or more CRST-led surveillance and/or data analysis initiatives to serve as a core set of indicators and to also develop and maintain a sentinel site network composed of experts on tobacco control data from selected priority communities to assist in the ongoing monitoring and interpretation of data. And as Kathy also already mentioned, CTP would be one of these sites. So if we go to slide 5, so CRST also has these additional responsibilities, including conducting cross-site data analysis for harmonized data, reporting to NIH and FDA on a regular basis, identifying approaches for translating, reporting, and publishing CRST findings for the scientific community and other stakeholders, and providing operational, administrative, and logistical support for these activities. So in a nutshell, that is what we are expecting this surveillance center to be able to do. So if we go to the next slide, there are a couple special considerations we just want folks to be aware of. The first is on the topic of non-responsive topics. CRST is meant to be a surveillance center. Thus, the following types of studies would not be appropriate. Studies that include human laboratory studies, such as fMRI or topography, things like the laboratory analysis of tobacco products, smoking machine studies or device analyses, studies that include biospecimen collection or analysis, or studies that include the environmental scan of policies. You'll also note that this RFA does not allow for clinical trials. The NIH definition for clinical trials is a research study in which one or more human subjects are prospectively assigned to one or more interventions to evaluate the effects of those interventions on health-related biomedical or behavioral outcomes. Again, this is a surveillance center, so studies that include an intervention component would not be appropriate. We have a couple other considerations to go through. The next slide. So this is a EO1 mechanism. Folks may be familiar with EOs, which are cooperative agreements with substantial federal, scientific, and programmatic involvement. So for example, the T-cores are U54s. One thing to note here is that the EO1 mechanism requires specific aims and does not require projects or cores. And this is something that has already come up in a couple emails that folks have been asking. So we want to just provide a little information and just say that, you know, when you're organizing your application, you could consider organizing by specifying how you will address the required topic area in separate specific aims, the organizational structure and associated activities. So all the other stuff besides those topic areas that are obviously critical to this work could also be described in additional specific aims and or in a graphical representation included within the application. You know, the EO1 allows for flexibility with how you decide to approach creating the center, and that's will hopefully be reflected in the creativity you have when you write your application. So we can go to slide 8, which also has a couple considerations for budget. So this is slightly unique. You know, we expect that there will be some lead time necessary when whoever gets the award builds up their center. And so the budget for year 1 is reduced. It's up to 2.8 million for fiscal year 2023, and then up to 3.8 million per year for the subsequent years. And again, this is to allow for the lead time that we anticipate whoever gets this award will need. And so let's see, we also have an additional consideration regarding T-cores and castles. So if we go to the next slide. So the CRST PD cannot serve as a PD of a T-cores grant. That being said, a PD on CRST can be a project co-investigator or core lead for a T-cores. Key personnel of the CASTLE awarding team cannot be included as key personnel from the CRST awardee team. And so when you're thinking about this, also consider carefully the level of effort that you're putting into if you decide to be on, for example, CRST as a PD and then also in some capacity involved in T-cores. Really carefully consider the level of effort you're putting into these large grants, as you know, we do take that into consideration to make sure that the folks who are applying can have the capacity to do the work. So slide 10, a couple of points we want to make sure we get to. Multiple aspects of the application will contribute to whether or not this is responsive. And these include things like a program of research that comprehensively addresses the required topic areas, which we went through, and the responsibilities, which we also went through, although of course quite briefly. All the specific aims must fall within the scope of the regulatory authority of FDA CTP, and no aims may address the non-responsive research topics, which we also outlined. So slide 11. It's strongly recommended that you discuss your research and your specific aims with contacts early. And so that would be Kay and myself. And we also recommend that you submit a letter of intent early to allow time for feedback as well. So if you go to the next slide, we have a little more information about what a letter of intent could include. Again, to clarify, letters of intent are not required, but they are strongly recommended just to make sure that all the effort you're putting into writing the application is getting you on the right track in terms of scope. Let's see, we are asking for letters no later than March 20th, 2022. And I'm not going to go through it, but these are the general items that we typically ask for folks to have. And I think most important are descriptive titles of the proposed activities and also a clear description of what your specific aims that you're proposing are. And then I think we only have one more slide, which is basically just that I encourage you to reach out to either Kay or myself. And also, as Kay mentioned, there is an FAQ. So that isn't up yet, but it will be shortly. And when it is, it's going to be updated. So if folks have questions here, they likely will end up on the FAQ. If folks start coming to us with questions, we'll update with the FAQ as well, so that everybody who is trying to apply has the most up-to-date information. Thanks everybody for your time.
That's fantastic. Thank you, Maria. And so next we will be going over some of the review issues that are specific to this RFA. And we have Jacinta Bronte-Tinque with us. Thank you, Jacinta. She is the Chief of the Risk Prevention and Health Behavior Integrated Review Group and the Acting Chief of the Healthcare Delivery and Methodologies Integrated Review Group at NIH's Center for Scientific Review. So Jacinta, I'll let you take it over. Thanks.
Thank you. Welcome and thank you. I will spend a couple minutes talking about the peer review process that will be involved. So when reviewers are looking at your applications, they are going to be providing an overall impact score. So reviewers will provide an overall impact score, and this will reflect the assessment of the likelihood of the project to exert a sustained and powerful influence on the research field. Reviewers will also consider significance. I'm sorry, the first slide has to be there. Okay, thanks. So in the consideration that will be given to significance, be sure that your project addresses an important issue or a critical barrier in the field, because reviewers will consider whether the prior research that serves as the key support for your project, whether that is rigorous. They will also consider whether the aims of the project are achieved, and if they are achieved, how will scientific knowledge or technical capability be improved? And very importantly, how will successful completion of the aims affect the concepts, methods, and technologies that are related to the manufacture, distribution, and marketing of tobacco products? Very important as well is the investigative team. Reviewers will consider whether the PIs are well suited to the project, and if you are an early stage or early career investigator, whether or not you and the team have the appropriate experience and training, and if it's an established team, has that team demonstrated ongoing record of accomplishments that can advance the field. Now, very importantly, if the project is collaborative or includes multiple PIs, be very careful in terms of how you structure this, because reviewers will take a close look at whether the investigators have complementary and integrative expertise, and will also look very closely at the leadership approach, governance, and organizational structure for that project. Next slide. Now, in the scoring of the application, reviewers will also consider innovation. Is your application challenging or shifting current research in the field of tobacco sciences as it relates to the manufacture, distribution, and marketing of products? And is your project proposing a refinement or improvement of any theoretical concepts or approaches or any new methodologies, and whether or not the outcomes will provide new information to develop the existing knowledge base that currently exists regarding manufacturing, distribution, marketing of tobacco products. Very heavily evaluated as well is the approach. So be very careful when constructing and pulling together your applications, because reviewers are going to consider the strategy and methodology and analyses that you propose. The teams should also include plans to address any weaknesses in the rigor of prior research that supports the project, and whether or not investigators have presented strategies to ensure a robust and unbiased approach. Very important as well to identify any potential problems or alternative strategies for your project. And if the project is in the early stages of development, you should also identify how the risky aspects of the project will be managed. Be sure as well to include plans to address relevant biological variables, sex as a biological variable, and for studies in vertebrate animals or human subjects, you should also be sure to include those plans. Next slide. Finally, the environment. Very important for the success of your project. So teams, reviewers will be looking at the scientific environment to see how it contributes to your project success. Very important as well is the institutional support that's there for the project, as well as the equipment and any other physical resources that you will have access to as an investigator for this project. And importantly, will the project benefit from any unique features of the scientific environment? So any specific subject populations or collaborative arrangements, you should be sure to identify those in the process of pulling together the grant application. Next slide. Now, there are some additional review criteria that are not given individual scores, but these will be considered as a part of the overall impact score. Very important is the protection for human subjects. You should provide a justification for the human subjects in terms of the risks to subjects, adequacy of protection against those risks, potential benefits to the subjects, the importance of the knowledge to be gained, and of course, any plans for data and safety monitoring. For any research that is exempt, the committee should evaluate the justifications for that exemption, human subjects' involvement and characteristics, and the sources of material. Very important as well to include women, minorities, and consider individuals across the lifespan. When the project involves human subjects, the committee will evaluate plans for the inclusion and exclusion of individuals based on their sex, gender, race, and ethnicity, as well as any inclusion or exclusion of individuals of all ages. So in your plans, you should provide adequate justification for the inclusion of certain individuals in terms of the scientific goals of your project. Vertebrate animals and biohazards are also considered. Again, these are not given individual scores, but will be considered as a part of the overall impact score of the application. Next slide. There are several additional review considerations. Reviewers will consider these items, select agents, resource sharing plans, the budget and period of support, but these do not affect the score. But they will provide comments on these as a part of the review. Next slide. Now, in terms of how we will arrange these peer review meetings, the reviews will be conducted by special emphasis panels, and of course, conflicts will be excluded. We will use standard NIH review procedures, and every applicant will receive a written feedback from the committee, and this is in the form of a summary statement. Next slide. As you know, NIH uses impact or priority scores For reviewers, the NIH score scale is a 1 to a 9, 1 being the best application with the highest impact, and 9 being the worst. All eligible reviewers on the panel will give an overall impact score for each discussed application. This average score is multiplied by 10 and rounded to the nearest integer, giving the priority scores for each application from 10 to 90, 10 being the best overall impact score. For not discussed applications, you will not receive priority scores. So if there are 100 applications, the top half, which will be 50%, will be discussed, and that top half will receive priority scores. For the bottom half that are not discussed, they will not receive priority scores, but you will still get a summary statement. Next slide. Now, if you have any additional questions related to the review process, please do not hesitate to reach out. This is my contact information, and thank you for your time.
Thank you, Jacinta. That was fantastic. Our next speaker is Crystal Wolfrey. And Crystal is our financial and grants management contact on the RFA. She's also the Chief Grants Management Officer and the Director of the Office of Grants Administration at NCI. So we're happy to have you here, Crystal. Thank you.
Thanks, Kay. Thanks, everyone. Good afternoon. I'm going to spend just a couple of minutes going over some of the important administrative aspects of this RFA and any award that's issued out of it, and reiterating some of the things that you've already heard. Next slide, please. So a couple of key dates and award information to pay attention to from the RFA has been mentioned. If you choose to submit a letter of intent, the due date for that is March 20th of 2022. Application due dates for this RFA are May 18th, 2022. And please note, late applications will not be accepted for this RFA. The plan is the earliest start date for the award will be April of 2023. The maximum project period length is 5 years, and has been noted that there are 2 different total caps in the RFA, the 2.8 total cost cap for the first year and 3.8 total cost for years 2 through 5. What I'd like to emphasize is this is a total cost cap, which means it's directs and all F&A costs associated with the application. And just note that applications from foreign organizations are not allowed. However, domestic organizations may include non-US components in the application. Next slide, please. So as has been mentioned, the award that comes out of this RFA will be a cooperative agreement, and cooperative agreements mean that there is planned substantial involvement of NIH staff in the research. The RFA does describe the terms and conditions for the cooperative agreement, and it also details the roles and responsibilities for the grant recipient staff, for NCI staff as the project collaborators, for TRSP and FDA staff as project coordinators, and then joint responsibilities for the CRST steering committee. Please note that all of the terms and conditions in the RFA will be incorporated by reference in the notice of award. Next slide, please. A couple of additional requirements for the award that comes out of this RFA. There will be a requirement for submission of annual research performance progress reports. Because this will be a cooperative agreement, the RPPR will be a non-SNAP RPPR, and it will be due 60 days prior to the anniversary date, and it will need to be submitted electronically via the NIH Commons. In addition, for this RFA, there is a requirement, and there will be included in the terms of award, a requirement for a mid-period progress report. It will be due every 6 months following the project start date. It will need to be submitted electronically. There is no NIH electronic submission vehicle for these types of progress reports. So what you will need to do is submit it via email to the grants management specialist who will be listed on the notice of grant award. And note that the scientific summary should be a maximum of 2 pages for this mid-period progress report. And then finally, because this is a cooperative agreement, the award will not have automatic carryover authority. So any balance of funds that remain from one budget period to the next, a carry forward of that money will require NIH prior approval. Next slide, please. So I have put my contact information, which is also in the RFA. So I'm happy to answer any questions that you have as you're putting together the application or submitting the application. Please feel free to contact me, or if you have questions now at the end of the webinar. Thanks very much.
Thank you, Crystal. That was fantastic. And thanks to all of our presenters today. This was really great information, and we're getting some questions in. But for those of you who are listening in, feel free to submit your questions through the chat box. As a reminder, again, if you submit the question to all panelists, it'll go to all of those of us who are presenting and backstage taking care of the technical aspects of the webinar. If you as a warning, if you send your chat message to everyone, then everyone will see you and you'll no longer remain anonymous. But again, so if you send your question to all panelists, those of us backstage here will see it. And so one of the questions that we have is pretty straightforward, and it's, can the PI of CRST be a PD on a research project in a T-course application? And the answer is yes. So what that means is yes, someone who is the PI of the CRST Center can lead one of the research projects of a T-course, but cannot serve as the overall PI of the T-course. So yes, your understanding is correct. Okay, and another question that we have is, given that this is a UO1, is there a 12-page limit to describe all the projects? And the answer to that is yes. Yeah, for the research strategy, to discuss the entire center, it is a limit of 12 pages. I don't know if Jacinta has any other thoughts on that, about the kinds of information that can be submitted in addition to that 12-page limit. Or if I don't have that correct, Jacinta, jump in. Let's see, we did get a question about small businesses, whether for-profit small businesses are eligible. Oh, okay, we got a question about small businesses as applicants. And yes, small businesses, for-profit businesses are eligible applicants, as you can see there, that are listed in the RFA. And if there are any other questions about that, the specifics of that, please be sure to contact us. Okay, and this is a question for all of our panelists. Let's see. I know the focus is on tobacco use. However, would a focus on secondhand or third-hand smoke be acceptable for this specific RFA? So I'll start that by saying, be sure that you note that all the topics within the research objectives must be covered within this center. And so when you take a look at those, but to the extent that secondhand or third-hand smoke can be a data point, that would be something that I would encourage you to speak with either Maria or I about that, because it really, again, the answer depends. It depends on how you're including it and where you're including it. And given that the way it's framed is going to be an important consideration on whether that would be a responsive topic, again, I strongly encourage you to send your specific aims and to discuss your plans with us before you submit your application. We also have a question asking if we can say more about the Sentinel sites. I'll start that, but Kathy, I would love for you to join in on this as well. The way that we're framing the Sentinel sites is the idea that we really assume that the applicant will be conducting some of this work, but we'll need a team of other researchers to fulfill all of the requirements of the RFA and to collect all of the data, the surveillance data that is expected. And so we use the term Sentinel sites basically to note that there will be collaborators or members of your team who will also be collecting information and, in essence, sharing it with the CRST. Kathy, do you want to weigh in and explain that more? And I know Maria also had explained some of this.
And Maria may want to jump in as well.
Yeah.
I mean, we recognize and acknowledge that there are lots of data sources already out there. And so there's not an expectation that the applicant is going to do all of the data collection themselves, and to find other places throughout the country that have data that are already doing some of the types of surveillance that we're asking for in the RFA, and use them as a site to then help collect data and feed the data into CRST to put like the big picture together. So that's why I had mentioned that CTP has some data sources, not all, and even the data sources we have are not totally 100% comprehensive. So for example, we do have access to Nielsen data, but given time constraints and priorities, et cetera, we don't have time to analyze all of the Nielsen data. This is just an example, so I'm not promoting Nielsen per se, but that's why I said we need to talk and coordinate, because we do some data analysis of Nielsen, but certainly it's not 100% comprehensive. So I hope that makes sense. I don't know if Maria, you wanted to add anything to that as well.
Sure. Well, I'll just add that, like was mentioned, I don't think the expectation is that one person can do all this by themselves, or that they would create it from whole cloth. And that's where the Sentinel sites are going to be really important. We expect that folks will be reaching out to other people and leveraging things that already exist. And so there is, like Kathy's mentioning, there's so much work happening and there's so much work that needs to happen. We really need a place where it can all come together, and where some of the work can happen there, and also where there's a good amount of coordination. And the other thing that, and I think this is actually specifically listed in the RFA, we're seeking innovation and direction from, the folks who are going to apply, to think kind of creatively about how this should look, and where their strengths are going to be that they're taking the lead on, and where they're going to reach out to other people. So yeah, that's all I really have to say about that.
Well said. Thank you, Kathy. Thank you, Maria. That was great. One of the questions is, how will the award be selected? And from the RFA, you can see that the scientific and technical merit of the proposed project that's determined by scientific peer review is the leading factor. And it's also based on the availability of funds and the relevance of the proposed project to program priorities. And that's in section 5.2 of the RFA. Also to remind everyone that this is an NIH award, and so NIH leads that process based on score, priorities, and funding. And let me take a look at what other questions are coming in. This might be a question for you and I, Kathy. Does marketing at the retail outlet fall under marketing or the marketplace?
I have to think about that for a minute.
I know, so do I. Marketing at the retail.
Well, I think it's a little bit of both. I think it could go either way, right? Because we know that tobacco companies pay for marketing within a retail outlet. So, that's a marketing, but it's also a marketplace. And so we want to be able to capture, the different types of retail outlets and what's happening at that level, because we know that people have where they get their tobacco products varies depending on access and convenience and price and marketing.
Fantastic, thank you. This next question might be something for Jacinta to weigh in on, but I'll start the answer, but Jacinta, let me know if you think that you can clarify this. Is the application constructed as like an R01 application? And my answer would be no. I really encourage you to read the RFA to identify the unique aspects of the EO1, as well as the NIH guide, the grants regarding the difference between the mechanisms. But Jacinta, maybe you have some more guidance on that. Oh, Jacinta, you're muted.
Sorry. Yes, the application should be constructed like the typical EO1 application is.
Right, and I'm thinking that, so as we don't confuse things, I think of an R01 application as being constructed with largely a single research project. And again, this has some unique aspects that would not fit what you would think of as a regular R01 application. So I don't know if I'm interpreting the question correctly. We have a question that states, is there a limit to the number of participating institutions? And I don't think so, as long as there is a justification for them. But again, I don't know maybe if anyone else has anything else to add to that, any of our panelists, but my understanding is there isn't a specific limit because there isn't a number specified as a limit. I mean, although there would be considerations for what your budget would be or for spreading the work thin, I suppose, but again, no specific limit. Okay, I'm going to check with some of my colleagues here, but I think right now that may be, oh no, we do have another question here coming in. Will synthetic nicotine products be counted as tobacco products? Kathy, what do you think?
Did you see how fast I turned my video on that one?
Thank you.
Well, I think that most people know that synthetic, I'm going to use air quotes, synthetic nicotine actually falls through the cracks under FDA authority because a tobacco product is defined as having been made or derived from tobacco. So for example, a lot of ENDS products that use nicotine, the nicotine is derived from tobacco. Now, having said that, it's not clear whether the synthetic nicotine is actually synthetic because even though companies may advertise that they're synthetic, until there is data or analysis, laboratory analysis to confirm that it's actually synthetic. And I understand, and I'm not the chemist, so you know, hopefully I'm not speaking out of turn, but I understand that there's some challenges around determining whether in fact it's synthetic. So having said that, yes, right now and I think this is in the FAQ that we have, are just kind of general frequently asked questions document on the TRISP website. We address synthetic nicotine and say that we can fund projects or include information about synthetic nicotine at this time because it's not clear that it's actually synthetic or not. And understanding the marketplace in the whole is important. And I know people have asked, and I just see a question about cannabis. FDA does not regulate cannabis or marijuana, but understanding, you know, when you think about people vaping and are they vaping nicotine or are they vaping cannabis, we need to understand the context that all of these behaviors are taking place. So again, as Kay started out the webinar, these are questions where I'm going to say it depends, and you need to contact, I would be in your best interest to contact NIH with these more specific questions, because a lot of times it depends on how things are framed. We can't study all synthetic nicotine. Obviously, FDA is acutely aware of the issue around synthetic nicotine and looking into how to address that. So stay tuned for that. But so the short answer, that was a long answer to the short answer of yes, it depends. We can include synthetic nicotine in studying from the FDA perspective.
Yeah, and thank you for knocking out that other question about, given that research happening in states that have legalized cannabis to different levels, should this be included in how it affects tobacco? And I think you covered that pretty well. And I'll just add that again, that the way that it's included, that data collection is included in the application, you risk having aims that are non-responsive, given that this is not regulated by the FDA, but it's an important data point to consider. So that's one of those areas where it'll be really important to make sure you're sharing your aims with us before you submit your application. And again, share those aims when you submit your letter of intent, because then you have the benefit of a team of NIH and FDA scientists reviewing those letter of intent aims to see if it raises any red flags for responsiveness. And we can provide you feedback at that time. I have a question that I think the answer to this also is depends. what is the appropriate % effort for a PI of a complex center like this? I don't know if Jacinta or Crystal want to chime in here, but I think that it really depends. This is going to be something that will be viewed by the reviewers. And in some ways, the answer to the question is, what would a reviewer think is an appropriate level of effort? I think as long as your level of effort is justified, well justified, I think that there isn't a number to throw out there for what's considered appropriate. I think it depends on whether there's a multi PI application, and again, how the sites are structured, that sort of thing. So, you know, the involvement of the PI in multiple aspects of the project. So again, that definitely depends and would be a topic to discuss with Maria or I or Crystal. We do have a question. Is it possible to have an example of a UO1 application? Jacinta, do you know if there are any resources? I can't think of one on the web easily available for a sample UO1 application. Do you know of anything?
No, but if you look on the CSR website, there's a lot of very useful information on putting together an application. But I have not seen an example of a completed UO1 application actually posted online. But there are lots of useful tips for pulling together an application on the Center for Scientific Review website.
And Kay, I would just add also on the NIH Office of Extramural Research OER website, there's a lot of information on tips on completing applications. So the UO1 isn't really any different than the R01. It's the structure's the same. Everything is the same as an R01 application for anybody who's submitted an R01 application. But we could certainly provide, I think, on your website, the link to the OER website that has a lot of valuable information on applications.
That's useful, thank you. So that is information that we'll try to include in our frequently asked questions document. Okay, one of the questions is, the review criteria discussed during the presentation are appropriate for regular NIH hypothesis-driven proposals. However, if I understand correctly, this particular RFA does not necessarily require hypothesis-driven research. This is correct, because this RFA does not allow for clinical trials research. This is surveillance. If so, how will innovation and approach be evaluated for this RFA? So again, Jacinta, you might have experience with the review, but let me also point out again, take a look at the RFA and our review criteria, because just as a reminder, the review criteria for Tobacco Regulatory Science Program RFAs has been modified. And this is not just for the CRST UO1, but this is for all TRISP applications. So the significance and innovation review criteria are somewhat modified to be specific for tobacco regulatory science. But Jacinta, do you have any thoughts on how applications that are geared less for hypothesis-driven research, or, you know, and instead towards things like surveillance, what the experience in review is for reviewers? Oh, you're on mute again, I'm sorry.
Yes, so as I mentioned, in terms of innovation for this specific initiative, the reviewers will look to see whether the application challenges and shifts current research in the field of tobacco science as it relates to manufacture, distribution, and marketing, and whether or not the outcomes provide new information to develop the existing knowledge base that informs, again, manufacturing, distribution, and marketing of tobacco products to protect public health. So that is how the innovation will be evaluated during the course of the review.
And Jacinta, you may want to actually assist me in answering this next question. One of the slides says the UO1 requires specific aims. and does not require projects or cores. Does this mean projects and cores are not allowed? If allowed, do you have any suggestions on how to incorporate the description of these projects and cores into the 12-page proposal? I'm going to start by saying the reason that it's correct to say the format for a UO1 application requires specific aims, and it doesn't require projects or cores, because think of that is something that is a requirement of, say, a U54 application. So the way that the application is structured doesn't allow for that framing the way that a U54 would, because a U54 would then be reviewed where the reviewers would be giving specific scores for the projects and cores, and that won't happen in this. In my opinion, it might be confusing to a reviewer to frame it as projects and cores, because again, that is something that has a different convention for a different application mechanism. So Jacinta, what are your thoughts on whether or not someone could use that terminology within the application?
I agree with what you just said about that being cores and sub-projects being confusing, given there's a 12-page limit. And it could be confused with, let's say, a PO1, where there are different cores and the structure is very different. So I'm in agreement with what you just said.
Okay, thank you. And Maria, yeah, do you have any thoughts on that?
I want to add, it might be useful context to say that we decided to go with the UO1 versus I think what other folks might be more familiar with, which is the U54, because we wanted to allow for flexibility in how folks decided to construct the center. We didn't want to have prescribed cores, for example, where you needed to do like you needed to have a particular type of core. The folks who are writing the applications will have flexibility for how they decide this should look. I think we kept it flexible even to the point of we want to make sure you can do at least one of these things yourself, and then who else are you going to reach out to? So I think it can be a little bit difficult to consider how to write something in a different way if perhaps you're used to writing a U54. But those specific aims, like we mentioned, can be used to articulate how you're going to address the topic areas, and also how you're going to address these other sort of structural elements, which again, we didn't ask for particular, very prescriptive ways that these should be described or thought about. We want you all to think about how these sort of organizational elements will work together. So hopefully, while it might be a little jarring to think about at the beginning, as you sort of think about it, you'll have some ideas for what you think these things should look like. And then in terms of how they're written, like Jacinta and Kay is saying, I agree, it would probably be confusing to have projects and cores as they typically mean one, a very specific thing. And also, again, you do have a shorter page limit to describe what you're doing.
Thank you, Maria. Yeah, that was a really great clarification. Okay, I'm going to bear with me as I take a look and see what other questions we might have here. Just a note to say it might be useful to clarify whether applicants should include support for data sources, that is, include funding. Should you be including funding for data sources like Nielsen data, even if FDA has those data? I believe the answer is yes, since the awardee needs to have access to its own data sources. Kathy, would you agree with that? Kathy, you're muted.
Sorry. And
No
yes, I agree with you. And on the slide where I listed some of the data sources or the kinds of data that CTP has access to, I didn't list all the specifics of what types of data sources. And obviously I use Nielsen as an example. So yes, I mean, if you want to purchase, contract different data sources, that should be included in the application. And again, because we don't cover 100% of everything that we have access to, that's where we would then coordinate with whoever the awardee is about, using Nielsen again as an example. Here's what we're doing with Nielsen data, And then here's what, the awardee is proposing to do so that we can coordinate those analyses, just as an example. So yes, you need to include the support, the amount that you'll be, dollar amount as part of the project of accessing or purchasing those data. And that's just one example, sorry.
Thank you, thank you. And I'm going to say that I believe that we have covered all the questions. So for those of you that have additional questions, so apologies if I didn't get to your question. I think I've exhausted them all here. But if you have additional questions, again, feel free to reach out to us. We've given you our contact information here, and of course, it's available in the RFA. And I'd like to thank our fantastic presenters today and thank all of you for your time and attention and your interest. And we look forward to seeing your applications. As a reminder, you'll have access to this webinar, the slides, the recording of the webinar, the slides, and a frequently asked questions document in probably about 2 weeks that are available on the Tobacco Regulatory Science Program website. So thank you and have a good evening.